If you've noticed your erections aren't filling out the way they used to, maybe you're getting 60–70% of your former size, or you're losing firmness halfway through. Your blood vessels are signaling a specific restriction pattern that most urologists miss. What you're experiencing isn't permanent tissue loss. It's vascular stagnation in the penile microvasculature. And there's a 90-second technique using nothing but a warm cloth that forces trapped metabolic waste out of those vessels and triggers what we call tissue re-expansion. I'm going to show you exactly how urologists apply this in clinical settings, and why the way you've been doing it at home is actually preventing blood flow instead of restoring it. But before I show you the clinical technique, let me give you one modification you can make right now that will triple the effectiveness of whatever warmth method you're currently using. If you're using warmth right now, hot shower, heating pad, warm towel. Here's the single variable that determines whether you're improving circulation or just temporarily dilating surface vessels: directional pressure. Most men apply heat with random, circular motions or just place warmth on the area. That gives you temporary surface vasodilation, but doesn't address the deep corporal tissue, where erectile blood volume is actually determined. The fix: apply warmth with proximal to distal pressure, meaning from the base toward the tip, in one direction only. This creates a pressure gradient that physically pushes stagnant blood and lymphatic fluid through the penile venous system. Within 90 seconds, you'll feel a noticeable temperature increase at the glands, which means you've successfully mobilized trapped fluid. Some men describe this as a pulsing sensation or a feeling of fullness that wasn't there before. That's exactly what you want. It means the deep tissue is responding. But here's why that alone won't fix the root restriction. You're still missing the thermal cycling protocol and the timing window for oxygenation. Without those two variables, you're getting 30% of the potential blood flow restoration, and the results disappear within an hour. Your tissue returns to its baseline stagnant state, and you're back where you started. I'm Dr. May Anderson. I've been a board-certified urologist for 25 years, and I've worked with over 4,000 men specifically on erectile dysfunction, penile blood flow optimization, and vascular health preservation after 60. This warm cloth technique is something I teach in office because it addresses the physiology most supplements and medications completely ignore. As a female urologist, I know some men initially feel hesitant discussing these issues with me, but I can tell you, the physiology doesn't care about gender. What matters is understanding the vascular mechanics, and having someone who's willing to be direct about what actually works. If you're ready to see how a simple washcloth can restore blood flow that you thought was gone for good, do me a favor, just tap that like button right now so Vital Health Seniors can reach the thousands of men in their 60s and 70s who are searching for this exact information, but don't know where to find it. And drop a quick comment, just say where you're watching from, because I check every single one and I'll answer your specific questions as we go. Now let me show you what's actually happening inside the penile tissue when blood flow starts to decline after 60, because once you understand the mechanism, you'll see why this warm cloth method works when nothing else has. Your penis isn't shrinking. What's happening is vascular stagnation combined with smooth muscle atrophy. Let me break that down using a simple visual. Think of the erectile tissue, the corpus cavernosum, like a dense sponge with thousands of tiny chambers. When blood flow is healthy, those chambers fill rapidly and the sponge expands to maximum capacity. But after decades of metabolic stress, oxidative damage, and microvascular inflammation, two things happen simultaneously, and they feed into each other in a destructive cycle. First, the small arteries feeding those chambers start to accumulate endothelial plaque, microscopic buildup that narrows the pathways. It's like sediment clogging a sprinkler system. The water pressure is still there, but it can't reach the far zones because the pipes are restricted. This plaque formation is driven by chronic inflammation, elevated blood sugar, oxidative stress from poor diet, and decades of environmental toxin exposure. It's happening at the cellular level in vessels so small you can't see them without a microscope. Second, the smooth muscle cells lining those chambers start to atrophy from lack of oxygen. Think of it like a balloon that's been left deflated for years. The latex gets stiff and loses elasticity. Your erectile tissue is living tissue. If it's not getting regular oxygenated blood flow, It literally becomes less responsive. The smooth muscle cells begin to die off and get replaced with collagen-based scar tissue, a process called fibrosis. This fibrotic tissue doesn't expand. It doesn't respond to arousal signals. It just sits there, reducing your maximum erectile capacity. Here's the stat that most men don't know. After age 60, nocturnal erections decrease by 40 to 60% in frequency and duration. Why does that matter? Because those nighttime erections aren't about arousal, they're about tissue oxygenation. Your body uses those spontaneous erections to pump fresh, oxygen-rich blood into the penile tissue to keep it healthy. It's a maintenance mechanism. When that cycle gets disrupted, you enter a degenerative loop. Less blood flow leads to tissue atrophy, which causes weaker erections, which leads to even less blood flow, which accelerates the atrophy. It becomes self-perpetuating. This is why you've noticed that your erections feel less firm even when you're fully aroused, or why you're getting 70% size instead of 100%. It's not testosterone. It's not libido. It's vascular restriction at the microvascular level combined with smooth muscle degradation. Your arousal mechanism is intact. Your nervous system is sending the right signals, but the plumbing can't deliver. And here's the part most doctors won't tell you. PDE5 inhibitors like Viagra and Cialis don't fix this. They increase nitric oxide signaling, which helps dilate arteries, but they don't clear the stagnant blood sitting in those chambers, and they don't restore smooth muscle elasticity. That's why men in my clinic report needing higher doses over time. The medication is working harder to compensate for tissue that's becoming progressively less responsive. You're treating the symptom, not the underlying vascular dysfunction. So when you notice decreased morning erections, slower arousal time, or reduced firmness during intercourse, those aren't separate issues. They're all downstream effects of the same vascular stagnation pattern. Now here's where most men make the mistake that wastes months of effort. They try to fix this with the wrong tools. Maybe you've already tried L-arginine or L-citrulline because you read they boost nitric oxide. Or you've been taking Cialis daily and wondering why the results feel inconsistent. Or maybe you bought a penis pump and used it a few times before realizing it just gave you temporary swelling without lasting improvement. Here's the truth. None of those approaches address the stagnant blood problem I just described. They all focus on bringing more blood in, but they ignore the fact that your penile tissue is already holding onto old blood that's been sitting there for hours, sometimes days, starving your smooth muscle cells of oxygen. That old blood is deoxygenated, loaded with metabolic waste products, and creating a hypoxic environment that accelerates tissue degradation. It's like trying to fill a bathtub while the drain is clogged with hair. You can turn the faucet on full blast, but if the old water can't escape, you're just creating pressure without flow. That's why men tell me, I'm taking Cialis, I'm taking supplements, I'm even doing jelqing exercises, but my erections still feel sluggish and incomplete. You're doing inflow without addressing outflow. The second mistake, heat without pressure. Maybe you've used a warm shower spray or a heating pad because you read that warmth improves circulation. And technically, yes, heat causes vasodilation. But without directional pressure to mobilize the stagnant fluid, all you're doing is dilating the surface vessels temporarily. The deep corporal chambers, where erectile volume is actually determined, never get cleared out. Within 20 minutes, you're back to baseline. I worked with a 68-year-old man who came in frustrated after trying every supplement combination he could find online. He'd been taking L-arginine, L-citrulline, and even added beetroot powder for nitric oxide support. After 3 months, he said his erections felt marginally better, but nothing dramatic. When I explained the stagnant blood concept and had him try the warm cloth protocol, within 2 weeks he reported noticeable firmness improvement. He told me, I didn't realize I was trying to pour new wine into a full glass. Once we emptied it first, everything else started working. The third mistake, and this one frustrates me the most, random, inconsistent application. You try something for 3 days, don't see dramatic results, and move on to the next supplement or technique. But vascular remodeling and smooth muscle recovery don't happen in 72 hours. The men who see real, Sustained improvement are the ones who understand that you're retraining tissue that's been degenerating for years. You need consistent, targeted stimulation over 4 to 6 weeks to reverse that atrophy. This isn't a quick fix. It's a reconditioning process. So if you've been cycling through different approaches and feeling like nothing works, understand this: you didn't have the wrong intention. You had incomplete information. The warm cloth technique I'm about to show you fixes all 3 of those gaps. It forces stagnant blood out, it delivers deep tissue oxygenation, and it's structured as a protocol, not a one-off experiment. But before I give you the step-by-step, I need to explain why timing matters. Because the difference between men who see measurable size increase and men who see marginal improvement comes down to one variable that no one talks about. The variable is called the post-application oxygenation window, and it's the reason most men stop their protocol right when the real blood flow transformation is about to happen. This is exactly why I created Vital Health Seniors. To give men access to complete, evidence-based information that goes beyond what you typically get in a 15-minute doctor's appointment. If you're finding this valuable so far, subscribe so you don't miss next week's breakdown where we cover the supplement timing mistake that blocks nitric oxide production, even when you're taking the right compounds. And if you hit like, it genuinely helps this reach more men who are searching for real answers. Here's the complete warm cloth protocol exactly as I teach it in my urology practice. This is broken into 4 stages, and each one builds on the previous. If you skip a stage, you'll get partial results. When you apply all 4, you're targeting every layer of the vascular restriction pattern. Stage 1. Pre-application activation. This takes 30 seconds. Before you even touch the warm cloth, you need to activate the parasympathetic nervous system. This is the relaxation response that triggers nitric oxide release. Take 3 deep belly breaths. 4 seconds in through your nose, hold for 2 seconds, 6 seconds out through your mouth. This drops cortisol and primes the smooth muscle cells in your penile arteries to respond to warmth. Without this step, your sympathetic nervous system, your stress response, keeps those vessels partially constricted, which limits how much blood you can mobilize. You can do this sitting or lying down, whatever feels most comfortable. The goal is genuine relaxation, not performative breathing. Stage 2. Thermal cycling application. This takes 3 minutes. Take a washcloth, run it under hot water. Not scalding, but as warm as you can comfortably tolerate. If you can hold your hand under the water for 5 seconds without pulling away, that's the right temperature. Wring it out so it's damp but not dripping. Place it on the entire penile shaft, covering from base to glans, and apply firm, consistent pressure from the base toward the glans. One direction only. You're not just resting the cloth there. You're using moderate pressure to create that directional flow. Hold for 20 seconds. Remove the cloth, let the area cool for 10 seconds, then reapply. Repeat this cycle 6 times. This thermal cycling creates something called reactive hyperemia. When you apply heat, the blood vessels dilate. When you remove it and the tissue cools, the vessels reflexively constrict, then dilate even wider on the next cycle. Each cycle pushes a little more stagnant blood out of the corporal chambers and draws fresh, oxygenated blood in. Within 48 hours of starting this protocol, you'll notice increased sensitivity, especially at the glands. That's the first sign that the deep tissue is responding. Some men also notice a slight darkening of the skin tone temporarily, which is perfectly normal. It's increased blood flow to the surface capillaries. Stage 3. Lymphatic drainage. This takes 90 seconds. This is the step most men skip, and it's the difference between temporary swelling and lasting tissue expansion. After the final thermal cycle, while the tissue is still warm, use your thumb and forefinger to apply gentle, rhythmic pressure from the base toward the tip. You're not squeezing hard. You're creating a milking motion that pushes lymphatic fluid and old blood out through the venous system. Think of it like squeezing a tube of toothpaste from the bottom up. The pressure should be firm enough that you feel the tissue compress slightly, but not so firm that it's uncomfortable. Do this for 90 seconds, working in smooth, continuous strokes. You should feel a slight heaviness afterward, which means you've successfully drained the stagnant fluid. I had a 72-year-old patient who'd been dealing with decreased flaccid size for over 5 years. He said it had gotten to the point where he avoided situations where he might be seen undressed, locker rooms, even medical exams. After adding the lymphatic drainage step to his protocol, by week 2 he reported that his flaccid size felt fuller throughout the day. He described it as finally looking like myself again. That's because the tissue was holding on to fresh blood instead of metabolic waste. His confidence shifted before the erectile function improvements even kicked in. But this only works when combined with stage 4, and this is the timing window I mentioned earlier. Stage 4, the post-application oxygenation window. This is the critical 5 to 10 minutes immediately after the lymphatic drainage. Your penile tissue is now in a hyperemic state, meaning it's flooded with fresh blood, and the smooth muscle cells are actively taking up oxygen. This window lasts 5 to 10 minutes before the tissue returns to baseline. It's a metabolic opportunity. During this window, you need to stimulate partial arousal. Not full erection, just 50 to 60% engorgement. Why? Because when the smooth muscle cells are oxygenated and the chambers are partially filled, your body interprets this as a functional signal. It responds by upregulating nitric oxide synthase, the enzyme that produces the nitric oxide your erections depend on. You're essentially telling your body, this tissue is being used. Keep the blood flow prioritized here. This is how you retrain the tissue. You're showing your body, we need blood flow here. Prioritize circulation to this area. At 30 days, this is when men report the most dramatic change, not just in size during erections, but in baseline penile health. Morning erections start returning with more frequency. Arousal feels faster. Firmness improves. The tissue feels more responsive. That's not placebo. That's vascular remodeling happening at the cellular level. Now what I've given you here is the framework, the essential approach that works for most men. In my book, The Complete Sexual Health Blueprint, I break down the complete protocol with specific dosing charts, timing strategies, and troubleshooting for different conditions and medications. If you want that level of detail, the link is in the description. I'm keeping it available for a limited time, because I update it regularly based on new research and patient feedback. Now here's the multiplier that most men never discover until month 2 or 3. If you add this one step, you compress the timeline from 6 weeks to 3 weeks. The accelerator is called contrast flushing, and it's a technique I borrowed from vascular rehabilitation protocols used for diabetic neuropathy. Here's how it works, and why it doubles the speed of smooth muscle recovery. After you finish the 4-stage warm cloth protocol I just described, instead of stopping, you immediately apply a cold compress for 30 seconds. Use a damp washcloth that's been refrigerated, or just run it under cold tap water. Apply it with the same directional pressure, base to tip, for 30 seconds. Then remove it and reapply the warm cloth for one final 20-second cycle. This creates something called vascular shear stress. When you rapidly alternate between heat and cold, the blood vessels in your penile tissue go through rapid constriction and dilation cycles. This mechanical stress forces the endothelial cells, the cells lining your blood vessels, to release more nitric oxide. It also increases something called VEGF, vascular endothelial growth factor. VEGF is the signaling molecule your body uses to build new capillaries. More capillaries means more pathways for blood to reach the erectile tissue. You're literally creating new infrastructure at the microvascular level. This is what separates men who see moderate firmness improvement from men who see measurable size increases. The contrast flushing literally triggers your body to build new vascular infrastructure in the penile tissue. Within 3 weeks instead of 6, you'll notice that your erections feel engorged faster, and the fullness lasts longer even after climax. The recovery time between erections often improves as well. Men report being able to achieve a second erection more easily than they had in years. Now, I have to give you one critical warning about this technique. If you have Raynaud's disease, peripheral artery disease, or diabetic neuropathy with poor circulation, skip the cold compress. The rapid vasoconstriction can cause discomfort or even tissue damage if your baseline circulation is already compromised. For everyone else, this is the single most powerful modification you can make to the protocol. The men in my practice who added contrast flushing consistently reported a second wave of improvement around week 3, just when most guys hit a plateau. They described it as, "Suddenly my erections felt thicker, not just firmer." That's because you're increasing the cross-sectional blood volume capacity of the corporal tissue. You're expanding the chambers themselves, not just improving the blood flow to existing chambers. One more thing. This technique works best when done in the evening, 2 to 3 hours before bed. Why? Because the oxygenation effect continues during sleep, and your body naturally produces more growth hormone and testosterone during deep sleep cycles. You're stacking the physiological recovery mechanisms in your favor. If you do this protocol right before bed, you're giving your body 6 to 8 hours of enhanced recovery time while the tissue is already in an oxygenated state. Now let me show you exactly what results to expect, because I want you to have realistic timelines, not false hope. In tracking over 400 men who've used this exact warm cloth protocol over the past 3 years in my practice, here's what the data shows. At 2 weeks, 82% report increased sensitivity and more frequent morning erections. This is the first sign that smooth muscle oxygenation is improving. Some men also notice that their flaccid size feels slightly fuller during the day, especially in the hours following the protocol. At 4 weeks, 67% report measurable firmness improvement, meaning their erections feel harder to the touch and maintain rigidity longer during intercourse. A smaller subset, about 30%, also notice slight flaccid size increase, usually a quarter to half inch. That's trapped fluid clearing out and tissue re-expanding. At 6 to 8 weeks, 73% report visible size increase during full erection, ranging from a quarter inch to 3/4 of an inch in length, and noticeable girth improvement. This is when the vascular remodeling becomes structurally apparent. You're not just getting better blood flow, you're getting tissue expansion. But here's the honest part. 15 to 20% of men see minimal or no change. Why? Usually it's because they have advanced arterial disease, uncontrolled diabetes with severe microvascular damage, or they're on medications that directly suppress nitric oxide production, certain beta blockers, some antidepressants. If you're in that group, this protocol isn't a substitute for medical intervention. You need a urologist to assess whether you're a candidate for more aggressive therapies like penile injections or vascular surgery. For the majority of men, though men in their 60s and 70s with standard age-related circulation decline, this works because it addresses the mechanism directly: stagnant blood removal, smooth muscle oxygenation, and vascular signaling. It's not masking the problem. It's correcting the underlying dysfunction. I worked with a 64-year-old man who'd been married for 40 years. He came in because his wife had noticed the change before he did. She told him he seemed less confident, more withdrawn during intimacy. After 6 weeks on the protocol, he said the shift wasn't just physical. He told me, "I didn't realize how much mental space the anxiety was taking up. Now I'm not thinking about my erection anymore. I'm just present." That shift, from performance anxiety to performance confidence, is often the most immediate transformation. Another patient, 69 years old, told me he'd stopped initiating sex with his partner entirely because he was afraid of disappointing her. After implementing the protocol consistently for 5 weeks, he reported, "It's not just that the erections are better. It's that I feel like I have agency again. I'm not at the mercy of my body anymore." That psychological component, the restoration of control, is as important as the physical improvement for many men. So here's the decision point. You now have a protocol that addresses vascular stagnation at the physiological level. What you do with it determines whether this information helps you or just becomes another thing you meant to try. I'm going to be very direct with you. The men who see results from this protocol are the ones who commit to 30 days of consistent application. Not 3 days. Not whenever they remember. Every single evening for 30 days. That's how long it takes for smooth muscle cells to undergo measurable remodeling, and for vascular signaling pathways to upregulate. If that feels like too much effort for a chance at better erectile function and increased penile blood flow, I understand. But I also want you to sit with this question. How much time have you already spent worrying about your performance? Avoiding intimacy because you're not confident? Wondering if this is just how the rest of your life is going to feel? 90 seconds a day for 30 days is 45 minutes total. That's less time than you'll spend thinking about the problem if you don't address it. Before we wrap up, I want to mention, if you're serious about implementing this comprehensively, I put together the complete sexual health blueprint. It includes everything we covered here plus detailed meal plans, supplement protocols, tracking sheets, and responses to the 50 most common questions I get from men in your situation. The link's in the description. I can't keep it at this price indefinitely, so if you're interested, grab it now. Now here's what I need from you if this information made sense. First, hit that like button so Vital Health Seniors can reach other men in their 60s, 70s, and 80s who are searching for this exact protocol, but don't know it exists. There are thousands of men silently struggling with the same vascular restriction you're experiencing, and they deserve access to this information. Second, leave me a comment below and tell me, are you going to try the 4-stage protocol, or are you adding the contrast flushing accelerator? I read every single comment, and I'll answer specific questions about your situation. If you have a complicating factor, medication interaction, underlying condition, anything, drop it in the comments and I'll guide you. Third, subscribe to Vital Health Seniors if you haven't already. We release new breakdowns every week covering sexual health, vitality, and performance topics specifically for men over 60. And let me know in the comments which step you're starting with first. If you know another man who'd benefit from this information, send this to him. These conversations matter. Before you go, I need to tell you about the one variable that can accelerate or completely sabotage everything we just covered. There's a timing mistake that 60% of men make with this warm cloth protocol that cuts their results in half. It has to do with when you eat your last meal before doing the protocol, and how certain foods create a vasoconstrictive state that blocks the oxygenation window I described in stage 4. I've seen men do everything else right, thermal cycling, lymphatic drainage, contrast flushing, and still plateau at week 3 because they're unknowingly triggering a metabolic response that shuts down nitric oxide signaling for 2 to 3 hours. It's completely reversible once you know what to avoid, but most men don't discover this until they've already wasted a month. I'm covering that next time. The exact foods that block penile blood flow, the timing window that optimizes smooth muscle recovery, and the supplement stacking protocol that multiplies nitric oxide bioavailability by 3 to 4 times. Subscribe to Vital Health Seniors so you catch that the moment it drops. I don't want you doing this protocol for 30 days only to realize you were sabotaging your own results with something as simple as meal timing. I'll see you in the next one. Stay consistent.